Gastroesophageal reflux disease, or GERD, is a common digestive disorder where stomach contents flow back into the esophagus. This backflow leads to uncomfortable symptoms such as heartburn, regurgitation, and sometimes even difficulty swallowing. GERD affects millions worldwide and can significantly impact quality of life. While many people find relief with medications, a substantial number continue to struggle with symptoms despite treatment. In this video, we'll explore a promising new approach for those with persistent GERD symptoms, focusing on a procedure called Anti-Reflux Mucosectomy with cap-assisted endoscopic mucosal resection, or ARMS-C. The first line of defense against GERD is usually medication, specifically Proton Pump Inhibitors, or PPIs. These drugs reduce stomach acid and often provide relief. However, about 30 to 40% of patients find that their symptoms persist even with these medications. For these individuals, known as refractory GERD patients, traditional surgical options like fundoplication are available. Unfortunately, these surgeries can come with a notable risk of post-operative complications, making them less appealing for many. This has led to the search for safer, less invasive alternatives. Endoscopic anti-reflux therapies have emerged as alternatives to surgery. However, many of these procedures are either expensive or technically challenging to perform. ARMS-C, or Anti-Reflux Mucosectomy with cap-assisted endoscopic mucosal resection, is a newer technique that aims to fill this gap. It is designed to be cost-effective, safer, and less invasive than traditional surgery, making it a promising option for patients who do not respond to medications. But how effective and safe is ARMS-C in the short and long term? Let's look at the evidence. To evaluate ARMS-C, a single-arm prospective trial was conducted at CHA University Hospital in Korea between 2018 and 2022. The study focused on patients with refractory GERD who had not responded to at least 8 weeks of double-dose PPI therapy. Certain groups were excluded, such as those with previous esophageal or stomach surgery, pregnancy, major psychiatric illness, large hiatal hernias, or severe esophageal motility disorders. This careful selection ensured that the results would be relevant to patients most in need of alternative treatments. The study included patients who continued to experience GERD symptoms despite taking high-dose PPIs for at least 8 weeks. Exclusion criteria were also important. Anyone with a history of esophageal or stomach surgery, pregnant women, those with major psychiatric illnesses, large hiatal hernias over 3 centimeters, or severe esophageal motility issues were not eligible. This ensured the study focused on a specific group of patients who might benefit most from ARMS-C. The ARMS-C procedure involves several key steps. First, the area around the esophagogastric junction, or EGJ, is marked, typically covering 60 to 80% of the circumference. Next, a submucosal injection is performed to lift the mucosa, making it easier and safer to remove. Finally, the mucosa is resected using a snare loop, all under endoscopic guidance. This technique aims to strengthen the anti-reflux barrier by altering the tissue at the EGJ, reducing the likelihood of acid reflux. To measure the effectiveness of ARMS-C, the study used both primary and secondary endpoints. The primary endpoints were improvement in GERD-Q scores, which reflect symptom severity, and reduction or discontinuation of PPI usage. Secondary endpoints included objective measures such as the Demeester score, acid exposure time, GEFV grade, lower esophageal sphincter, LES pressure, and peristalsis rate. These comprehensive outcomes helped assess both symptom relief and physiological changes. Out of 120 patients initially considered, 96 underwent the ARMS-C procedure and were followed for at least 6 months. Of these, 22 patients were followed for 2 years or more. This robust follow-up allowed the researchers to assess both short-term and long-term outcomes, providing valuable insights into the durability of the procedure's benefits. The results were promising. The average GERD-Q score, which measures symptom severity, dropped significantly from 10.67 to 7.55 after the procedure. Additionally, 37.5% of patients were able to reduce or completely stop their PPI medications within 6 months. These findings suggest that ARM-C can provide meaningful symptom relief and reduce reliance on long-term medication for many patients. Looking at the longer-term results, the benefits of ARM-C appear to persist. Among patients followed for 2 years or more, 86% were taking reduced or no PPIs, and 80% reported ongoing improvement in their symptoms. This suggests that the procedure not only works in the short term, but can also provide lasting relief for many individuals with refractory GERD. Beyond symptom scores and medication use, ARM-C also improved several objective measures. The Demeester score, which quantifies acid exposure, improved from 4.75 to 3.9. Acid exposure time decreased, and the GEFV grade, which assesses the anti-reflux barrier, improved from grade 2 to grade 1. These physiological improvements support the clinical findings and suggest that ARM-C positively impacts the underlying disease process. Safety is always a top concern with any medical procedure. In this study, ARM-C demonstrated a strong safety profile. No serious adverse effects were reported. 9 patients developed simple strictures, a narrowing of the esophagus, but these were successfully treated with balloon dilatation. The absence of major complications highlights ARM-C as a safe option for patients who have not responded to other treatments. ARM-C not only relieves symptoms, but also appears to improve the anatomy and function of the esophagus. By resecting mucosa at the EGJ, the procedure may enhance the anti-reflux barrier and even improve esophageal motility. While the exact mechanism for improved peristalsis isn't fully understood, the positive changes observed in this study are encouraging for both patients and clinicians. While the results are promising, it's important to recognize the study's limitations. This was a single-arm, single-center trial, meaning there was no comparison group, and all patients were treated at one hospital. Larger, randomized controlled trials are needed to confirm these findings and to better understand the long-term safety and effectiveness of ARM-C. Ongoing research will help clarify which patients benefit most and how best to use this innovative technique. In summary, ARM-C offers a promising, minimally invasive option for patients with refractory GERD. The procedure has demonstrated significant improvements in symptoms, reduced medication dependence, and a strong safety profile. As research continues, ARM-C may become an important tool in the management of GERD, especially for those who have not found relief with traditional therapies. Patients and clinicians alike can look forward to more effective and safer treatment options in the future.